Welcome everybody to the 5th Annual Parent Network Conference and Workshop. We are pleased to have you join us for Knock Knock, Who's There? What to Know When Child Protection Comes to the Door. Before we get started, I have a few housekeeping items. If you have questions during the session, please go ahead and use the Q&A feature below instead of the chat. It makes it easier for us to keep track of comments. We have polls that pop up, and I just want to make sure that you know they're anonymous and to go ahead and take them so that we know who we are speaking to right now. After the session, you will see a survey that comes up on your screen. Please take it. It helps us understand a little bit more about the session and how we can make things better for next year. If you are an Idaho parent, we are excited that our Idaho Parent Network survey, our next one, has gone live this week, and we're really looking forward to the feedback that we will receive so that we can help improve the system in Idaho. So go ahead and take that. A survey will come in a video, in an email link tomorrow, but it was also on idahoparentnetwork.org if you want to go take it now. So in the coming days, we will be posting this presentation and the slides so that you can go back and look at it, as well as some other resources to help you. So do check back with idahoparentnetwork.org in the coming days. So with that out of the way, we would like you to enjoy Knock Knock, Who's There? What to Know When Child Protection Comes to the Door with Chris Freeburn from the Department of Health and Welfare and Amy Marie, a parent with the Parent Network. Go ahead and take it away, guys.
All right, thank you, Laura. Well, good morning, everyone. My name is Chris Freeburn. I have worked a good portion of my career in the child welfare field, but want to claim that I am not the expert. It is a very broad field and chapters and layers of the work in child welfare, so I just continue to learn things about it every day. I also worked for several years at the state hospital in Blackfoot with adults with mental illness. I'm a proud father to 2 teenagers, and my wife and I are both social workers, so my poor kids get a double dose of parenting through a social work lens, so that makes life quite interesting. But I am really excited to be here today. I want to acknowledge my co-presenter, Amy, and her willingness and courage to offer the parent perspective. So thank you, Amy, and I will pass it over to you.
Thanks, Chris. Like Chris said, my name is Amy. I'm a parent of 8 children. 5 of our children we adopted through the Idaho foster care system. Our children have a variety of severe emotional disturbances. They have a history of childhood trauma, and we have 2 children on the autism spectrum that have other developmental delays and challenges. The struggles we have faced have led me to volunteer my time as a mental health advocate in a variety of settings, including associations with the Idaho Parent Network for Children's Mental Health, the Children's Mental Health Subcommittee, and Region Behavioral Health Board. I'm also a board member of Community Suicide Prevention and the Executive Board Secretary for Community Youth in Action. I am also the chair for the Citizens Review Panel in our region, which reviews open CPS cases for the legislature. We want to thank the Idaho Parent Network for Children's Mental Health for sponsoring this workshop and having this important session. In order to get through all of our material, we're going to present our information first, and then we will take time at the end for questions. Feel free to use the chat feature during our presentation, as it will be monitored for questions.
So we are going to be talking mostly about internal health and welfare processes, but I want to acknowledge that we have many partners and stakeholders in this work that make up the entire child welfare system. So that includes the courts, law enforcement, CASA. You may have heard of the CASA program, Court-Appointed Special Advocates. We have child advocacy centers, probation, corrections, schools, and many others. And we just possibly couldn't do this work without them. And then I just want to acknowledge that, as you notice, our title is Knock Knock, Who's There? That's typically the lead into a joke, but we know this really is not a laughing matter. You know, depending on your experience or knowledge of child protection, it can be kind of a emotionally charged topic or just confusing or difficult to understand. So really our hope is that by the end you'll have gained something useful and helpful to you, and we'll ask you also to feel free to reach out to us for additional questions. So with that, our objectives today are to help you gain a basic knowledge of Idaho's process for responding to and assessing reports of abuse, neglect, and abandonment.
Participants will have the opportunity to learn from a parent's perspective on working with child welfare social workers.
And then towards the end, we will connect you to other resources that we hope will be helpful. We have some links and other resources at the end of our presentation. So just a high-level overview of child welfare in Idaho. We have 4 main focus areas. So the first is receive and prioritize reports. Second is respond to and assess allegations. We provide ongoing case management services, and then we assure that children have safety and permanency. So the one we'll talk about today is that second one, respond and assess allegations.
Chris, can you start at the beginning of the process and talk about reporting? Who is required to report? What number do they call? And who takes these reports?
Absolutely. So Idaho is what we call a mandatory reporting state. And that means every adult is required to report suspected child abuse, neglect, or abandonment within 24 hours of observing or gaining knowledge of those concerns. So in Idaho's law, it does specify certain professions or individuals that must report, but then it goes on to say that anyone who has reason to suspect must make a report. So essentially everyone is required to report. In Idaho, we do have one exception to mandatory reporting, and that has to do with duly ordained ministers who receive a confidential confession. And if you want to look that statute up for more information, it's section 16-1605. And that outlines quite strict conditions for an exception to mandatory reporting only in those circumstances. So it's very limited there, but otherwise everyone's required to report. Idaho also has a central intake unit in Boise. So on the screen there, you see we have several ways to make a report. And the unit itself is located in Boise and staffed by licensed social workers. So they take the reports for the entire state, and it functions much like a call center. So they take calls any time of the day or night, weekends, holidays, 365 days a year. And this unit's job is to determine if the report falls under the Child Protection Act, and if so, they send it immediately to the appropriate region for follow-up.
I know in a few minutes we're going to talk about reports that are assigned to a worker, but what happens to a report that doesn't meet the criteria? Is there anything that is done in those cases?
Yeah, and sometimes we'll hear in child welfare that I called to make a report and nothing happened. And certainly if you don't see that a worker was assigned, that may feel that way, but every call that we receive, every report is documented in our system as information. I'm sorry, if it's not assigned to a social worker, it's documented as information only. And of course, not every report is going to meet our criteria, but it's at least documented. And then the second thing is that it's always reviewed by a supervisor or lead worker before it's closed. So it gets that second look. Again, if it's not assigned, it gets a second look to make sure that we're making the right decision. And then lastly, I just want to mention that in Idaho, our role, child welfare's role, is focused on what's happening in the family home. So if we get a report due to something that a neighbor did, or a daycare provider has hurt a child, or let's say a relative or family friend that's not living in the home has done something or accused of doing something, we report that to law enforcement, and our role ends there. So the only time we get involved in that situation is if it's alleged that the parent is unwilling or unable to protect that child from harm. Otherwise, if it's not something in the family home, we send that to law enforcement. So just some stats for you really quickly. During fiscal year 2019, we received just over 23,000 reports, which is about average for a year. Nearly 11,000 reports were assigned to a worker to conduct a safety assessment. We had just over 12,000 calls that were not assigned, but were documented as information only, kind of like we just discussed. And then two other quick points here. Callers can be anonymous. However, it is helpful if they leave their contact information. So if the report is assigned to a worker, the worker can call that person back and just verify the information and get more details if there are any. Otherwise, people can remain anonymous if they'd like to. And this link here at the bottom is an annual legislative report. And this, if you'd like more information, this provides information about referrals and foster care numbers and goals of the program, things like that. So I think it's a pretty helpful report.
It is. Great. Thanks, Chris. I know how difficult it is to find out that your family has been reported. Unfortunately, for families raising children with mental and developmental disabilities and children you've adopted who have a previous history of trauma, reports are not uncommon due to the behavior of our children and the nature of the challenges they face. Just so you know, you are not alone. Once I started to meet other families like mine and hearing their stories, I no longer felt singled out, and it has softened the blow. I am not saying that it is easy or it should be taken lightly by any means. It's hard every single time, and it leaves a lasting effect on my family. You can experience a lot of different emotions and feelings such as fear, anger, betrayal, embarrassment, anxiety, depression, frustration, and vulnerability, leaving you feeling defensive, helpless, hopeless, and powerless. These are all normal reactions, and it is okay to feel this way. It's important for parents to know not to shoot the messenger, so to speak. Social workers are doing their jobs following up on the referrals. Mutual respect goes a long way. It is totally understandable to be upset and frustrated, but being able to realize it is not the social worker's fault that this has happened can be helpful. Now, granted, the workers can make a positive or a negative impact on how they go about doing their assessment. So far, everyone that I've worked with at Child Welfare have been respectful and forthcoming. Most often, we have been contacted by phone prior to a worker showing up at our home. There have been a few times, though, that this has not happened, and I still have lingering anxiety when I hear my doorbell ring and I am not expecting anyone. I have always been welcoming and accommodating. When a worker calls ahead of time, you can arrange for a time for them to visit your home when a person of support can be there with you. This could be a spouse, a friend, or a service provider. I highly recommend this, even if this is not your first rodeo. Chris, can you talk about the process of calling ahead? When does this occur and why in only its circumstances?
Yeah, thanks, Amy. So typically, this will happen when the report is not about immediate danger. So we get calls about a hazardous living conditions or concerns about inadequate supervision. Those would be two examples. So these are non-life-threatening calls where we don't need to respond immediately, but we would go ahead and try to attempt to call ahead and make an appointment with you. So the worker is not going to be able to go through every single aspect of the assessment. They don't do it by phone. So they would just call ahead and let you know that they have been assigned to follow up on a report, and then make an appointment with you. Oops, okay. Are we on? There we go.
Yep.
All right, over to you, Amy.
Yep. Before we talk about the safety assessment process, what are some things that we should know as parents, regardless of what the allegations are?
Yeah, so first off, the worker cannot tell you who made the report, and this can feel very unfair, kind of like what you face your accuser. But this is a protection by law. We have to protect the person who made the report. So both the police and us have to protect their identity. And often a parent will be able to guess who made the report, but the worker can't engage in a guessing game, if you will, about that. They just have to move on to the nature of the report. So that's number two. They're going to talk to you about the allegations and tell you what those specifics are. And as a parent, you have a right to know what was reported. And so I just encourage parents to ask as many questions as they need to. This third bullet, we may be accompanied by law enforcement in certain cases. So There are certain cases where we are required to respond with law enforcement. And when the case is assigned to a worker, it's assigned a priority level as well. So we have either a priority 1, 2, or 3. So any calls that are a 1 or a 2 require us to coordinate with law enforcement. And these are calls that involve a life-threatening or emergency situation, something like serious physical abuse or medical neglect that requires a more immediate response. We are required to take law enforcement with us. A priority 3 that I mentioned just is more like a hazardous home environment, lack of supervision, those other 2 examples. We have to respond within 5 calendar days, and we don't need to take law enforcement situation. So just to explore this a little bit more with you, law enforcement's involved for a few reasons. So first of all, it's a best practice to minimize the number of interviews for children and parents in these cases. That's pretty paramount in these cases, not to put children through multiple interviews. So that's one of the reasons why law enforcement's with us. Secondly, law enforcement's there to also help determine if a crime has been committed. So you may hear a parent getting charged with injury to a child or child endangerment would be some examples. And that is not the role of a social worker. That's strictly a law enforcement role. So if a crime has been committed, law enforcement takes the lead in that. A third reason is worker safety. So unfortunately, some of these reports involve allegations of other criminal activity, or there's family violence occurring, or allegations of substance use. So law enforcement is also there to join for worker safety purposes. And then last, in Idaho's law, there is a requirement that the county prosecutor has a protocol to handling these cases through multidisciplinary teams. So it's not an entire that responds to the home, but some of these MDT members enter the case at different times. So there may be medical personnel, there may be a child advocacy center involved, there's the prosecutor's office, sometimes school officials. Those individuals make up an MDT, and in many areas of the state, they are meeting weekly or monthly to discuss and make decisions about high profile or complex cases. So that's just a little bit more about why law enforcement's involved. Just important to note that. And then last bullet there is, as we said, if we have correct phone numbers, the worker may contact you before making a home visit. And so, again, this is the best practice. We're not really in those cases, we don't really need to catch people off guard. So when able, we try to do this so we can hopefully lessen the anxiety. I'm sure sometimes it might increase anxiety, but we try to do this wherever possible. So let's talk about the safety assessment. So this is called our comprehensive safety assessment, and it is a tool used to guide the process and to document our findings. And we're just going to be touching on a few things about it. It's much more involved than what we'll be able to share today, but really the first thing the worker is going to do is review the report and any other reports that we've received in the past. And then, of course, if it requires response with law enforcement, then they make those arrangements. Next up, we need to see and interview the children. And our protocols require seeing and interviewing children within specific timeframes. And sometimes we see children after speaking with the parents, and sometimes it is before speaking with the parents. And if this is the case, the worker has to notify you immediately after seeing your children. And then we also have to see children that are in shared custody situations. So if the child doesn't have primary residence at your home, but has visitation, then we are also required to see that child as well. We talk with parents, of course, and any other adults in the home. And besides the specific allegations, the discussion with parents is really aimed at understanding how your family operates every day. So we may talk with you about parenting in general, discipline, how the children are doing, how they're functioning. We want to know if there's services that your family needs or that you're receiving. And note I would make is when I did these cases, even if abuse or neglect didn't happen, I was often providing referrals to community services. Even again, if we're not going to stay involved, I found it a really rewarding part of the job to help link families to services that they needed or requested. So Amy, anything you'd like to add about
Sure.
your experience? Sorry, I just got some really bad feedback there.
There have been times my family have been visited, or my children have been visited at school before I received a phone call from the department. And I have teenagers who do not like getting pulled out of class, and they will tell me that next time they're going to refuse to talk with the social workers. And I acknowledge their feelings, and I remind them that it's best to be respectful and to cooperate so the worker can get their report finished and close our case, and we can move on with our lives. Those teenagers have become very blunt with the workers on WhatsApp and how they feel about these reports being made. It's important for parents and workers to understand this process not only affects the parents, but it impacts the children as well, even if the family stays intact. Some children have a harder time talking with a stranger alone. In these instances, I have requested another trusted adult to be with them during the interview. The more information the family can share with the social workers, the better they are able to determine the safety of the home and identify resources, like Chris said, that the family might need that they were unaware of before. I have two stories I want to share in regards to this. The first one is, I can remember our first caseworker that interviewed us was the only person to ever tell us about children's mental health as a resource for services that our private insurance would not cover. And we had been working with providers for 8 years at that point. I can also remember another time when law enforcement returned our child who ran away in a psychosis state of mind. The officer told us of a facility right there in our own hometown that offered acute treatment for crisis intervention that we were, again, completely unaware of, and our providers had failed to mention it was an option. So those are just two examples where resources were offered by law enforcement and CPS that we needed desperately and used that we otherwise would not have known about prior to the crisis and the intervention. You want to put up the next slide, Chris? For parents who have a child with developmental, behavioral, or mental health conditions, there is some helpful information for parents to have on hand to give the social worker. I keep current spreadsheets to hand out to all of our medical, mental health, and DD providers and schools, and now CPS. These spreadsheets include household names of everyone in the home, their date of births, all of their medical and mental health diagnoses, their medications, service providers, and how often they are seeing them. This information is also requested for the adults in the house. It may seem like an invasion of privacy, but this information is used to accurately assess and to understand the overall situation of the family, to identify any unmet needs, and to provide support, help, and resources for those areas. I already have up-to-date hard copies, and I also email my spreadsheets to the assigned child welfare social worker. This saves a lot of time during the interview process, and it helps them to fill out their report more efficiently and accurately. It also helps you as a parent not to forget anything during the stressful time. If you're like me, you may have all this information memorized and you can rattle it off on demand, but in those high stress situations, when your emotions are running high and your mind is going a mile a minute, you'll be grateful to have those spreadsheets at your fingertips. I also provide copies of my children's most up-to-date comprehensive diagnostic assessments, their psychological reports, and every treatment plan from every provider. The more information I have on hand, the easier it is for the social worker to complete their assessment because they don't have to spend the time collecting a lot of information when I already have done the legwork. But it's okay if you don't have it all together and on hand. They will work with you to get the information needed. I already keep this information on hand to collaborate with providers and schools on behalf of my children. It takes a lot of time and organization on my part, but it is helpful for everyone involved, and I am grateful when they openly acknowledge their appreciation for it. It also sends the message that you as a parent are on top of things, you've got it handled to the best of your ability, and you are willing to cooperate. If this all sounds very overwhelming and you don't know where to start, reach out to Idaho Parents Unlimited for trainings and resources, or ask your current family support partner to help you with this. If you don't have one, I highly recommend getting one.
Thanks, Amy. And I just have to say, as you're probably thinking, Amy kind of sets the bar there for organization, and you know, it's not the expectation that's how you have to do this with child welfare, but we'll talk about collaterals in just a minute. So I want to just briefly go back to children with mental health concerns too. So sometimes we get reports that allege abuse or neglect, but when we get into it, we can see that the situation is really impacted by symptoms or behaviors related to a child's mental health versus the parent being abusive or neglectful. And this is not about blaming the child. I think it's just that, you know, if we respond and that is the situation, we do want to work together and identify what's happening or what's leading to this, identify any services or supports that might help. So just worth acknowledging there. So next up for our assessment is collateral contacts and consultation. So Amy just gave us a nice several examples of what collateral contacts are. So these are people that the worker will ask permission to contact who know your family firsthand. So these may be extended family members, friends, neighbors, service providers, as Amy alluded to there. And the worker may request other medical or treatment information to better understand the family situation. So all of this does help us get the clearest picture possible. Again, the worker is going to ask you for these contacts and ask you to sign releases if it's something more formal. And then the consultation piece is, I think, just worth mentioning that workers don't do these assessments in isolation. There's a lot of consultation involved with their supervisor or their team to help them identify anything that they may be missing. It helps the worker also stay on target with our practice and within our scope. So consultation is definitely a heavy part of the process.
I give the social worker a complete list of all of our providers and their contact information, but they usually only ask for one or two people that have the most interaction with our family for making contact. I have chosen different people at different times depending on the situation and the referral that has been made. I pick people that have the most information on our family and have spent extensive time in our home, like our son's DD worker, our in-home family therapist, and our family support partner, all of whom know the background on all of our children, and they are familiar and understand our unique family dynamic because they have spent a lot of time in our home. And more often times than not, my providers have already been debriefed by me of the situation in efforts to collaborate and help that child in need before that report is even made to the department by an outsider looking in. That's how I roll. I'm an open book and I sometimes get burned for it, but in the long run, I believe it's the best way to do things. I contact my providers and give them a heads up that a referral has been made and the nature of it. I believe in total transparency with all parties involved because I have nothing to hide. Because I have established a rapport with my providers ahead of time and they know our family's history with the department, this is not an uncomfortable conversation. And they thank me for sharing and they are willing and eager to do what they can to help. I am grateful to the providers and professionals that interact with our family that truly do understand the impact of mental health, developmental disabilities, and childhood trauma, and how behaviors of and interactions with these children can be quite alarming to the general public. And it is a breath of fresh air when someone can see through it all and put it into context for what it really is. I know this may not be the case in every situation. I know it took time with my own providers, but I know it is possible. Of course, the first couple of times I was contacted by the department, I was completely blindsided and I was not well prepared. I had no one to walk me through the process and tell me what to expect on this side of the fence. This is why I am willing to share my experiences with other families and help them better prepare. And again, for them to know that they are not alone.
Thanks, Amy. And I do want to just say, again, I think it's a unique opportunity to hear from Amy about the parent perspective. When we do training for foster parents, one of the things that we do is a panel, and we have a birth parent that has been through the process be able to share that perspective. So that's the only other time I've seen us have a parent talk about this. So thank you again, Amy. As we get here on the end of the assessment process, the worker, after gathering all the information, has two decisions to make. So first is what we call the disposition. So did abuse, neglect, or abandonment occur? And in Idaho, we have two dispositions, either substantiated or unsubstantiated. So substantiated, of course, means there was enough information to confirm that it occurred. And this is not just a gut feeling by a worker. There's specific criteria outlined in our rules that must be met to call it substantiated. And then unsubstantiated is it did not occur. And sometimes we get reports where it was what we call erroneous or completely false. And that may not be malicious intent on behalf of the reporter. It just may mean that whatever they saw or heard was completely false. So we have a little qualifier there on unsubstantiated. And then the next one is if we just are not able to confirm or that there was insufficient information to conclude maltreatment happened is the other qualifier with that disposition. So the worker will discuss the disposition with you and also provide written notice of that decision. And if a parent is substantiated, they do have the right to appeal that decision and are provided the instructions with how to do that. The second decision is a safety determination for all the children in the family. So in other words, are the children safe or unsafe? And again, this is also not just a gut feeling. The worker, again, working through our assessment process and consultation and utilizing their tool and their experience and knowledge will reach that decision. And so if the children are considered safe, then our work is essentially done and we close the case. If the children are considered unsafe, then it's a decision about whether they remain in the home or it's an out-of-home case. So either way, we open the case for ongoing case management, which we will talk about in just a few minutes.
Once I receive the letter that we have been unsubstantiated and the assessment referral is now closed, I go to my child welfare office with my valid ID and request my records in writing. I keep a file in my home of all of our child welfare records. You don't have to get your records, but it is one of your rights. As mentioned previously, we have the right to know what was reported. We can request referrals and services, and we can also appeal a substantiated decision. You can also request information to be corrected in the report if there is a discrepancy. We can hire an attorney, and we can also refuse to talk with the worker. Chris, can you explain a little more on these rights?
Yeah, absolutely. And just a note there on records. So you do have the right to get your records. And if it wasn't clear before about who made the report, that if there is a person that's identified in the record, if they've given their name, that information is redacted and removed from the record. So, and any identifying information. So if let's say a school counselor calls, we'll darken out their name, and if it goes on to say it's the school counselor, we would remove that as well. So the name and identifying information would be redacted from that record. So onto the rights, yeah, absolutely, you can hire an attorney, but our assessment is not a criminal investigation. And if the assessment leads us to open a case for ongoing monitoring, that goes through a court process, a civil court process, not criminal though. And in that case, parents do need an attorney and will be informed about that. But at this stage, most parents don't hire an attorney right off the bat during the assessment process. You can, but we don't see it very often. And then, yes, that last one, you can refuse to talk to Child and Family Services. You can refuse to allow access to the children in your home. If this happens, and if we have immediate safety concerns, we may seek a court order or request law enforcement assistance. The worker gets right on the phone with their supervisor to staff what the right direction is. And again, I would say this is pretty uncommon because most people want to know what's going on. They want to get to the bottom of it. And we also have definitely situations where parents admit what's happening. They are in crisis and they really want to get help. So we head down that road too. So the bottom line is we just encourage parents to work with us voluntarily and to work through it. It's absolutely understandable, as Amy talked about, all those emotions of being nervous and scared and angry. That's very common. And then last year, I just want to mention that we, in January, published a brochure for parents to answer the questions that we're kind of talking about. It describes their rights, and we hand it out during each assessment so that parents know what the process is when we leave. And it's available in English and Spanish and is also on our website as well. So we've talked about reporting in the assessment process, and there's more to these points, these next few points, than we have time for today, but just to briefly cover when a case is opened. So back to our safety decision, if a child is determined to be unsafe, then we must provide services to the family to help them address the safety concerns. And we have two types of cases in which the children stay in their home while we work with the family. So the first is a voluntary case where there's no court process involved. It's just us and the family working together on a case plan. And then we also open what's called a protective supervision case. And this is where the department petitions the court to have involvement and have the court's oversight. Again, the children stay in the home in this case. And in both examples, voluntary and protective supervision, we do what's called a case plan that outlines the goals and tasks to address the safety concerns, and that also addresses, I apologize, also addresses what needs to happen for us to close the case.
Services on a case plan may include substance abuse treatment, mental health treatment for the child and or parent, housing and financial assistance, transportation, parenting classes, and connecting with other community resources. One of the most common fears that parents have is, will my child be removed from my home? Let's talk about the ways children can be placed into foster care.
Yeah, so one note I'd make here is that oftentimes television or movies can depict a scenario where a social worker just walks into the home and they can remove the child. And that is not the case. In most states, it's not the case in Idaho. So social workers can't just remove kids by themselves. Entry into foster care is only through one of these three ways, and that starts the third type of case, which is foster care case. So that first one there is most common, is when law enforcement declares a child to be in imminent danger, and they can place the child in the temporary custody of health and welfare. The second way is when the department files a petition for removal. A judge reviews this and looks for why it's unsafe for the children to remain in their home, and the judge can issue a removal order. And in this situation, there still needs to be a primary issue of immediate safety and basically conditions that mean the child's safety cannot be maintained in the home, even if there's some services. So, and then I just want to add briefly that when children enter foster care, there is a court hearing within 48 hours, and that determines if the child stays in custody or returns home. And there are other planned court hearings throughout the case, but the judge has the final say.
And the third way is a Rule 16 expansion order. In this situation, a judge overseeing a juvenile justice case can expand it into a child protection case. The court must have reasonable cause to believe that the juvenile comes within the jurisdiction of the Child Protection Act and places the child in the temporary custody of the department. We've never had an open case on our family, but we have been on the other side. We were foster parents for 4 years, and during that time, we had 24 foster children in our home for varying lengths of time. And like I said before, 5 of those children have become a permanent part of our family. I have met many wonderful foster parents and caseworkers throughout the state. I know a lot of us have only heard the unfortunate events and rare case scenarios that hit the news, but I can tell you those instances are few in comparison to the many families that open their hearts and homes to provide safety for children in need, and they do it out of the goodness of their hearts and for the right reasons. And for the caseworkers I have had the privilege to work with as a foster parent, it is not just another job for them. The amount of work that is required of them is unbelievable. They are overworked and underpaid in a very high stress job, and they do not take their responsibilities lightly. They do want what's best for families within the limits that the law allows. I like to believe the majority of them are doing the best they can with the resources and time they have. I know they go to bed at night thinking about the kiddos in care and those that have returned to their families or have found new forever homes. I know for a fact that my favorite caseworker still thinks about our kiddos that we've adopted often, and it's been 6 years now since we have closed our license. Since we're on the topic of foster care, I have to put in a quick plug. And for those who have considered fostering or just want to learn more about it, call the Idaho Care Line at 211 for more information. There are many other ways to help foster kiddos and families without becoming a foster parent as well. Now back to child welfare. The goal of child welfare is reunifying children with their families if at all possible. Most children are returned to their families once resources and safety measures have been put in place and parents have shown a pattern of safety and stability. In Idaho, typically, about 70% of children in foster care are successfully reunified. You can find more information about the Idaho Child Welfare Program on the Idaho Department of Health and Welfare's website. Additional information regarding support and resources for families can be found on the Idaho Federation of Families and Idaho Parents Unlimited. For more information on the rule expansion, please refer to the newly released Handbook for Families, Understand How the Juvenile Justice System Works in Idaho.
And I want to mention that Health and Welfare is in the middle of transitioning our website. The landing page, the main landing page will stay the same, but one of the things I'm excited about is that we've added a whole portion for parents. And so our brochures, like we talked about in this presentation, are going to be on there. We have a lot of resources that are really aimed at helping parents understand the process. Of course, we have a page for foster care, adoption, kinship caregiving. We have independent living program as well. So we're excited about that new website. It should be a lot better than what you have now. But just know if you visit it today, it's going to go live in the next, hopefully the next several days. So be sure to check back. So that really completes our presentation. Our emails are there in case you'd like to send us a question down the road. We're happy to take questions that way. So we'll send it back to you, Laura, for questions. And I guess I just want to say thanks to Amy for also serving as a foster and adoptive parent. And that's, you know, we couldn't say thank you enough for what you've done and your involvement with the program. So thank you.
Thanks.
So while we have been talking, while you guys have been talking, we've had some people raise their hands, but we need you to actually type a question in because we don't have a way to know what you need. So you can either go through the Q&A session or you can go ahead and put it in chat if you just want to send it directly to us and not the whole group. Also, we just wanted to talk a little bit about changing records. One of the benefits of getting your records is to see if there are any issues or any things that are inconsistent. We do have a parent that said that there was some information that was incorrect, and she had the ability to go ahead and change that. Amy and Chris, could you kind of tell us the process behind identifying that you have a problem and then doing something about it?
Well, like you said, Laura, the only way to know is to request your records. And then when you are reading through it, if there's a discrepancy, which I have found in past, whether it be my child's name, their date of birth, a diagnosis that I've given them, that kind of information that is unbiased can be corrected in the report. And you can set up an appointment to meet with your caseworker and their supervisor, or you can give that information over the phone, whichever's easiest for you.
Okay, then do you need to request
So Chris,
a new report?
I'm sorry, what? And then we request a new report to make
Yes.
sure that the changes have been made.
Okay.
Yes. So Chris, I have a couple of questions from a parent's perspective. When does a CPS case turn into a criminal case? You did talk about that previously.
Yeah, thank you. So again, just to be clear, they're two separate cases. So if law enforcement is working on determining if there's criminal charges, that is separate. That goes through the criminal court system. So this is just like being issued a citation or being charged with the crime. That goes through a completely different system. So the child welfare court cases are, again, they're through typically the juvenile court in that county. In many places of the state, that is done by a judge that specializes in family court, and it is, again, it's a civil court process. So charges are not part of that process. It is just through a civil process. So totally separate tracks.
Great. And what paperwork should a parent ask to see before a child is removed?
Yeah, so back to, again, the worker can't simply just show up to your home and take the child. We have, so when a law enforcement officer declares a child to be in imminent danger, or again, if there's a removal order, like we talked about, or that third way, a judge expands the case from juvenile justice to child welfare, all of those involve paperwork. And so it should, it varies on what the content is, but it will inform the parent that their child is being removed from their custody. And so without getting into too many details, there's always paperwork. So if a parent's ever presented with that decision's been made and there's no paperwork, they kind of need to stop the show and tell the worker they need paperwork. But our workers are trained that that's not their authority. They aren't able to do that. So I can't think of any situation I've heard in Idaho where that's happened. But.
Do families have a say in which foster family their child is placed in?
Yeah, great question. So one of the very first things, and this has been in practice for many years, is the emphasis on family connections. And so if we have a child coming into foster care, we're going to talk with the parents about any possible relatives that could take that child or family friends, just to give examples. And so we do have an expedited licensing process in Idaho that actually, it doesn't completely license that person in a day, but if we have a child coming into care and we have the name of that relative and they are within the area, we can actually get them to that person if they pass some preliminary checks. They need to go on and continue the foster care licensing process. So that's one way. Yeah, absolutely. Another way is parents, if they disagree with the placement decision. So let's say the child's been in foster care for a few weeks and they disagree with the placement they're in, they can petition the court through their attorney to request that decision to be reviewed. But most of the time what we see is parents are trying to get their child to someone familiar to them, a relative, a family friend. If that's not possible, then we have children in the foster care placement.
What if the kiddo has problems with the foster family that they're placed? Can they request a change in placement?
Yes, and so, again, I don't think we see this a whole lot. There's, it's a difficult time for kids in foster care, and so they may not like the rules or just what they're experiencing. So first, we absolutely try to work that out informally. Workers going to be talking with the foster parents. They may sit down, they may have a meeting and talk through what those challenges are. If a child is absolutely set on leaving that placement, they can, through their attorney, similar to the parents, petition the court to have that placement decision reviewed. So, but most of the time we see that we're trying to work it out the first way as I described it.
So what is the average stay of a child in foster care?
Yeah, so in Idaho, kind of one of the things you touched on, most kids are reunified. About 70% of the children are reunified with their parents, and that's within the first year. It might be 7 months, it might be 9 months, but usually within the first year. We have some laws that also guide how long kids should be in foster care. So many years ago, there were some laws that really emphasized children, if they cannot return to their parents and they need to be adopted, like as in the parents have had their rights terminated, we try to achieve that within 2 years of entering foster care. Might seem kind of like a long time, but parents also have a right to try to work to get their children back. And so there's some really strict processes that are part of if a parent is not able to have their child and their rights are terminated. At the end of the day, 2 years is kind of our benchmark if that's not possible.
And one last question in regards to the right to choose not to vaccinate your child, does that fall under medical neglect in the state of Idaho?
Yeah, great question. Kind of a sensitive one too. I know that can be very controversial, but no, it does not fall under Idaho Child Protection rules or statute. Vaccinations is a parent choice. When it comes to medical neglect, there is a provision in the law that allows a parent to not seek medical treatment for their child if it's based on their religious beliefs. So for example, if they believe that their child's medical condition can be healed by spiritual means, then the child protection doesn't have a role in that. They cannot be charged for that if they're claiming that is through religious means. So that again is kind of controversial. There's been some attempts to have that law reviewed in the past, but to your question, no, vaccinations would, if we got a call that said so-and-so is not vaccinating their child, that would get recorded as information only.
Well, thank you so much, Chris, for doing this presentation with me. I hope we have cleared up some misinformation and offered resources for our families. And just remember, if you have any more questions, please feel free to reach out to us or look to the resources that we've provided at the end of our session. Thank you.
And thank you, Amy.